So I'm just going to give you a couple of examples of both the research question, the objectives and the hypothesis, and then the plan associated with those. So the aim of this study was to investigate the effect of an intervention to enhance sense of coherence, that's SOC, and oral health quality of life, and explore determinants of oral health quality of life in children. So this was a previous study that I conducted with Peter Robinson here in the school and one of our PhD students, Aura One Namontri. So this was the whole aim of her PhD, and she had three very specific objectives. One was to establish an intervention to enhance sense of coherence. Two was to assess the effectiveness of that intervention. And three was to explore determinants of oral health quality of life. And she had a number of hypotheses which were detailed in advance, which she could then analyse too. So the primary hypothesis was that the school-based intervention would enhance or increase sense of coherence. The second one was that the intervention to enhance sense of coherence would improve oral health quality of life. So they're very specific primary hypotheses that she then went on to analyse and address. The secondary analysis, which we sometimes call exploratory analysis, was that greater sense of coherence would predict oral health quality of life, but that also greater socioeconomic status, so things like parental income, education and occupation, would predict better oral health quality of life. And then lastly, that clinical status, so the kid's amount of tooth decay or periodontal disease or whatever, would not be related to oral health quality of life. And each of these hypotheses came from the research literature. So there was a lot of research evidence there in the background part of the protocol, which then led to these hypotheses. So in terms of the data analysis plan, obviously this is a very busy slide. I just wanted to give you a feeling for the types of things we write when we're talking about analysis and how specific those points are. So CPQ is the oral health quality of life measure for kids. So we've got the total CPQ score, sense of coherence score, and oral health belief score at baseline. So they were all assessed at baseline, and then they were assessed again at 2 weeks and at 3 months after the intervention. So we calculated total scores for each of those, and then we checked the reliability and validity of those scores. She then went on to analyse in 3 phases that were mapped very specifically onto those objectives and hypotheses I've just talked about. So firstly, she described the data in phase 1. She then evaluated the effect of the intervention. So you remember that primary hypothesis that the intervention would enhance sense of coherence, and then enhancing sense of coherence would lead to better oral health quality of life. Well, she did this through what's called restricted maximum likelihood estimation, mixed effects models, and she detailed that in her analysis plan. So the thing that I want you to take away from this is that you have to detail the measures, what you're using within your statistical tests, what you're going to put into them, and what tests you're going to use. And it's really important that that's detailed before you begin your data collection, because only then will you know that the correct tests are there. And then for the secondary objectives, that exploration of the determinants of oral health quality of life, she carried out Pearson's correlation to look at relationships. And then she did something called structural equation modelling, which is a far more complex statistical technique to look at different predictors of oral health quality of life. So you'll see that there were very different tests that she used to meet her different objectives. So hopefully by showing you this, it's not to put you off, but to show you the amount of detail that you need before you begin your data collection. Here's my note of caution. It's one of the most common things when I'm looking at protocols is that they don't detail what they're going to analyse and how they're going to analyse it. So never write your protocol and hand it in without thinking about your analysis plan. The next step in the components of the protocol is ethics. So ethical considerations are really important. You need to think about your data confidentiality, how you're going to maintain confidentiality for your participants, and if needed, anonymity as well. It depends on the type of study. It may not be that it's anonymous. So who's going to collect the data, whether their names are going to be on it, how you're going to keep those records, whether there's any side effects of the study that you're going to be doing, if so they need to be detailed in advance. You need to make sure that you allow your participants the right to discontinue. They need to be able to drop out of the research if they don't want to continue any longer. You need to think carefully about the incentives and rewards you're giving. Sometimes we give incentives for travel, for example, or taking part in research, and this is absolutely fine. You just need to say that and state that in the protocol. Another thing that's really important is if you have people taking part in research, then it's really important to give them an idea of what you found out. And so often when we take part in do research, we send our participants a very concise or short summary of the research, what we were trying to find out and what we did find out. And it means that they're then involved in the research process and they can see that their taking part in it was worthwhile. So specific things in your protocol that you need if you are not doing a secondary analysis. So if you're doing primary data collection, you'll need to have informed consent sheets. You'll need information sheets for your participants. You'll need to state very specifically about confidentiality and anonymity, how you're going to collect the data, store it. And this is important if you've got to go to an ethical review committee. So here, if you need to use people within the general population, not in the NHS setting, you will have to get university ethical approval for research. If you're going to use people who work in or are patients in the NHS, then you'd have to get ethical approval through the NHS. And so all these things are vital for those processes. We do have examples of all those consent and information sheets within the school from previous research. So there are examples that you can look at if you're going to use them for your own research. Okay, so moving on then towards the end of the research protocol, you need to specifically state the timescale for your research, and the reason why we do this is so that you know that it's going to be feasible and doable. So you need to think about how long it's going to take you, and you need to provide benchmarks for particular aspects. So you can see here just, it's quite general. So months 1 and 2, prepare your study tools. Months 3, pilot testing. Months 4 to 8, recruit and collect data, etc., etc. It's not specific as in week by week, but it gives the milestones of the project. And you can think about whether you're going to have the time to collect your data, analyse it and write it up in the term you have available. Resources, the extent of this depends on the audience. So for your Masters in Dental Public Health protocols, you may not need this section, but with research more generally outside of the course, then we have to specify, for example, the resources that we need, the cost, whether that be the people involved, the finances involved. It needs to be detailed and it needs to be well justified for the research study and the source of the funding as well. And then finally, references and appendices. A key part, we don't use bibliographies, we use reference sections. So never include a bibliography, which is all the things that you might have read as a background to your study. We only include reference lists, so that's all of the references that we've included within the protocol. You must limit the number of references to just key articles. This is not a whole literature review that you would have in your dissertations. This is a concise summary of the literature to date. So you shouldn't have too many references, just the key ones. And always follow the recommended style for your reference section. Your appendices will obviously depend on the kind of study that you are conducting. So if you're doing a questionnaire study, you will include all of your questionnaires within your appendices. You may include the variable list with the definitions. If you're collecting data with participants, you may have the letter that you're sending to them, the information sheet, the consent forms. If you're doing a systematic review, you might have the data extraction sheets for that systematic review. If you're doing qualitative work, you may have the focus or interview schedule that you're going to use for your interviews. Just finally, I've gone through all of the main points of the protocol, so the generic components of the protocol that you will always need to use when writing up a protocol. Just to talk very generally about the pitfalls that you should try to avoid. So these are the things that we see most commonly when we are giving feedback or marking protocols. The first is that people try to be too ambitious, and that's great. It shows that people are enthusiastic and they're interested and they want to do good research, but the problem is that you need to just focus down and be very specific. So have a key question, 1 or 2 key questions that you want to answer. Don't try to answer a very, very broad, big question. Secondly, there's insufficient attention to previous literature. So you need to make sure, whilst the background to the protocol is quite short, that you include the key points of previous work that's been done in an area. And that may be that it's not been done in dentistry. It may have been done in medicine or within the social sciences. And all of that literature is relevant and valid. I think the main one is that people poorly formulate objectives. And the most common is that they are unspecific, so they don't make them specific and measurable enough. So concentrate on writing those objectives in the SMART style and making them as specific and measurable as possible. Not enough detail on design and methods. So again, as I've said previously, think of it as a recipe. You've got to write down exactly what you're going to do and who's going to do it and at what part you're going to do it, so that somebody else can do your study. Absence of pilot or testing, pre-testing before you begin to make sure that your materials are up to the job and are going to get the data that you want. An inappropriate or underpowered sample size. So sometimes we can't do sample size calculations, and that's fine. We don't have the data to do those with. But if you have got data to do a sample size calculation, then you need to. It may be that people have included invalid or unreliable instrumentations or measures. And often we see inappropriate analysis, and that may be because there's not enough detail on the analysis that's going to be used, or it's the wrong statistical test, or there's just not enough there to say whether what they're going to do is appropriate for the data that they're going to collect. That's it.